Next in our trigger point therapy series, we have our trapezius. There's 4 heads of the trapezius. The first head, which is at the external occipital protuberance, to spinous process of C7. Then there's the second head, blends with the first head near C7. It's the lateral third of the clavicle and acromion. Then the third head, which blends off the second head from the acromion to the spine of the scapula, then to C7 through T3 spinous processes. Then the fourth head, which blends from the third head to the spinous process of T4 through T12. Now, our pain referrals for the trapezius are the temporal region, behind the eye, jaw pain mastoid process, posterior neck, occiput, posterior shoulder, and between the shoulder blades. Some symptoms of aggravated or active trigger points in the trapezius are tension headaches, behind the eye headache, and also jaw pain. Those are all if it's coming from the upper portion of the trapezius. If it's coming from the middle portion of the trapezius, you could have headache in the posterior neck and occiput, or pain in the shoulder and into the rhomboid area. For your lower portion of the trapezius, you could be having pain in the posterior shoulder, supraspinatus area, and sometimes a burning, tingling feeling, or pain in the posterior neck along with the cervical spine and into the occiput and the mastoid process area. Different techniques to be able to better reach knots and trigger points in the trapezius require different body positions for you and your client. For the first head of the trap, it's easier to work cross body, so either from across the body or at an angle. For the second head of the trapezius, it's easier if the client's arm is hanging at a 90-degree angle off the table. For the third head, it's easier if the arm is bolstered directly under the shoulder. And for the fourth head, you'll need to use this zit grip while their arm is on the table in the position that the client is currently in. This client is loose, so I'm able to address and find these trigger points in no matter what position he's in, but you may find it hard to find trigger points as well as work them on certain clients, so you may have to change up to these positions that I listed. There's multiple ways to work a trigger point. You just have to be able to use a tool for a longer amount of time. Now, working with a client, you have to make sure that you and your client agree on a means of communication. Typically, we use a number scale, 1 or 0 to 10, to make sure that you and your client always stay on the same page of what is happening and what is going on, and number scale just seems to be the fastest way to communicate. Now, typically, we aim for a 6-7 on the pain scale. You want to hold this pressure or this pinch grip at a 6-7 on number scale until the client states that they start to feel a release or you start to feel a release. Then you'll hold it until it releases as much as it needs to. This may take a while depending on how large the knot is or trigger point is, how long it's been there, and whether or not they can handle this a 6-7 on the number scale for as long as it needs to release. Make sure you're communicating with your client, make sure that they're breathing, and just hold until it's ready to be released or it releases underneath you. You can see here, I'm working one of the trigger points that runs along the middle of the trapezius. In this video, I'm only working ones that I was able to find on him. Ones that you see I hold and then let go, it's because he only started at about a 4 with those, and so I held it till it released, and then we moved on. Later, when I work on the other side of his back, there are some trigger points that almost hit an 8 when using the same amount of pressure that I'm using on this side. You'll find that some clients with more repetitive injuries on one side of the body or just disproportionate tension from one side of the body to the other may find that one side of the body trigger points are extremely painful, whereas on the other side it feels good to have them worked on. You'll notice that in between techniques, in between that direct pressure on the trigger point or that ischemic compression on the trigger point, I check how the skin is doing, how the tissues are doing. Sometimes you may have to attack a trigger point more than once. It depends on how well the client releases. Just take your time, use your intuition, your palpation, your observation skills, and go off these charts at the beginning of the video, and have fun.